What can be done in Africa to slow these rapidly growing numbers of people with diabetes?
We need awareness from central government level, provincial level, district levels, to chiefs must get involved to know about diabetes. Then they preach awareness. Church leaders also need to participate and make people understand the dangers of diabetes and its complications.
The Bible says that when Paul was writing to Timothy, he says, exercise profiteth your body. So as a church, we are very much alive to the fact that we will not only pray for people to get healthy, but we also would like them to do their part while God does his part. We have programs in place which include, but not limited to, we have every Saturday morning aerobics and refit programs where there is a trained someone or a coach, professionally trained, to come and show our people how to do their exercises so that they keep fit. Once every year, particularly again in the month of May, we pick on one Saturday that our people, all our church members, are invited to come and participate in a program called Walkathon and Fun Run. It is an awareness program to show our people that they need to always exercise and remain fit.
People must actually be taught about diabetes to such an extent that even in medical school or nursing schools, they must be taught thoroughly about these things, because we need people who understand and implement this thing thoroughly. And then we also make our communities aware of the importance of sticking to our own traditional foods or fruits, which are less harmful. We do not want to have piles of drugs only without asking people to follow what is correct through whatever various group, be it a group of teachers in school, colleges, be it army, police, everywhere where people are grouped. The education on diabetes must be thorough. You will find that these figures may not be reached if we really embark.
My name is Prosper Ngobe. I'm the admin officer in Mpilo Central Hospital. I'm also the trainer of Mpilo aerobics team. We started in 2019. That's where we started doing our aerobics exercises at Mpilo. So it's a group that is composed of doctors, nurses, student nurses, general hands, and all other supporting staff in the hospital. So these aerobics help us in terms of to keep us fit, also help us preventing diseases like hypertension, diabetes, etc. So to keep us fit, as well losing weight as Mpilo staff.
In our towns, we want also to create gyms, pathways, parks, where people in town can exercise and look after themselves well. Because right now, if you want to run, you have no running space. So we need people to be able to do this. And we need to encourage people to exercise where they can walk, let them not drive.
Type 2 diabetes, which contributes more than 90% of the diabetics, can be prevented, or at least its onset be delayed. There are proven ways of preventing yourself from diabetes.
I exercise on a regular basis. We eat as healthy as possible. We try to buy a lot more vegetables so that our meals are more vegetarian based.
We can prevent diabetes by moving more and eating less. So if you do exercise, at least 30 minutes of brisk walking for 5 days a week, if at least 50% of what you eat for your lunch and dinner are vegetables, quarter or less is starch and quarter is protein with minimal fat. So if you, and then if you stop smoking, quit smoking, if you are going to drink alcohol, it has to be in very modest quantities. So that is for men not more than 21 units, which is usually 21 pints of beer per week. or 21 tots of whiskey a week. For women, 14 is the cutoff point. So for that, usually delays or avoids diabetes.
Often symptoms of diabetes are not severe or may be absent, especially in type 2 diabetes, as in the case of 46-year-old Noel Jackson, whose wife, Jamie Jackson, has been diabetic for more than a decade.
This came as a result of one of the regular days when we were there, and I was curious of when she was testing, because you just prick your finger and then you're looking at the glucometer. And one of the days after Christmas get together, having cake and tea and all these luxuries that we're having, I randomly tested myself and I found that my sugar had excelled to 14 points. And then my wife was like, you know, that's not normal, because she works for physicians and she knows the circumstances that are around the readings of the sugar. So I then went to a doctor who then said, yeah, if your sugars go up to 14, that means you're diabetic and you need to start measures. So in my case, I did not experience any symptoms or anything of the sort.
Okay.
Yes.
Okay.
I didn't experience any symptoms or anything of that sort. So I just started now also being responsible and changing the way I do things.
Okay. Consequently, in the absence of routine screening, high blood sugar sufficient enough to cause changes in our bodies may be present for a long time before the diagnosis is made. This was the situation with Noel's mom.
How we got to discover that my mom had diabetes was she didn't know for all her life, and they used to have ice cream and everything. She lived a normal life like a normal person. But as time went by, she started having sight problems.
Okay.
Yes, and she kept saying that, hey, my eyes, like it's going blur.
They're getting more and more blurred.
Yes, so eventually we took her to the doctor, and that's when she discovered that her sugar was way out of control, and her readings were somewhere above 20. And yeah, so it was a scary thing, and we then started implementing and got her onto insulin and all that. But a lot of the damage was already done.
Everyone above 40, for example, above 40 years of age in our community should be screened for diabetes. At least once a year should have an HbA1c. If the HbA1c is not normal, if it's pre-diabetic, it has to be every 3 months. Then people with a family history of diabetes should be screened. And then, of course, people who are symptomatic. And then people who fit what we generally call metabolic syndrome. So if you have hypertension, you should be screened. If you have truncal obesity, in other words, if you have a big tummy, you must be screened. People who have hypercholesteremia or who have high cholesterol should be screened. And then mothers of big babies. So if you have just delivered and your baby is more than 4 kilos or 4 kilos and above, you must be screened for diabetes. Mothers who have had intrauterine deaths that are not explained should again be screened for diabetes.
14 years ago, I had my son, 2006. 2007, I conceived, which I had a miscarriage. 2009, I conceived my daughter. 2018, I had another stillbirth. The first stillbirth was at 4 months. The second one, it was 4 months again.
4 months again. So both of them, they were 4 months?
4 months, yes.
Okay, then do you remember the birth weight for each of your babies from the first one?
From the first one, my son was 3.9, my daughter was 4.1 kgs.
Losing 6% of your body weight and adding 150 minutes of exercise per week cut your risk of developing type 2 diabetes by up to 60%.